Hey there, good morning. Thank you so much for joining us on this Facebook Live discussion. I am Megan Knight, anchor on Good Morning Maryland, and today we are going to be talking about hip fractures, who this impacts the most, and how we can treat this and get the best outcomes possible. And joining me this morning is Dr. Jamie Johnston. He is an orthopedic surgeon with GBMC Health Partners Orthopedic Surgery. Good morning, Dr. Johnston. Thank you for joining us.
Good morning, Megan. Thanks for having me.
Absolutely. All right, let's get right into it. Oh, by the way, if you have any questions for Dr. Johnston, we would love to get those questions answered for you. So you just leave your question in the comment section and we will take those as we talk to Dr. Johnston about hip fractures. So what are some of the hip fracture services that you offer there at GBMC?
So we have a specialized hip fracture service that's a collaborative, multidisciplinary group of orthopedic surgeons and medical specialists, nurses, physical and occupational therapists, and pharmacists, and care managers. And what we realized and around the country and at GBMC is that it really takes a large team in order to effectively care for patient hip fractures. Oftentimes, they're older patients who have many medical issues, and we all have to work together in order to get the best results.
Very good. So, I mean, maybe let's just talk about the hip fractures themselves. Who you mentioned that it does tend to be older patients, which I think is what a lot of people think about when they think about breaking your hip or hurting your hip. But could it happen to younger people as well?
Yeah, that's a great question. So, if you watch the Ravens, these players are out there getting hit and falling, and they're not typically breaking their hips. But older patients, they will just be walking down the stairs or trip and fall. We call it a ground level fall, and they'll break their hip. And that's an indication that there's something not quite right with their bone. So most of the fractures that we see are in patients older than 60s, 70s. So more of them occur in women than in men. It's because of osteoporosis. So as you age, particularly in women, when they go through menopause, they lose estrogen. And that is a major factor in losing bone strength. And the older they get, some patients, depending on their family history and other risk factors, can develop very severe osteoporosis. And it's a silent disease. So you wouldn't know that you have osteoporosis until you have a fracture. So oftentimes the first indication that a patient has osteoporosis is that fracture, which can be quite a wake-up call. And so we always we have a number of things we do. We can talk about that a little bit later, but that we do to help prevent people have fractures. But in general, it's an older group. And the other thing that's important is if you don't fall, you don't fracture. So fall risk is a big issue, and as patients age, their fall risk goes up and their bone health goes down. So the combination of the increased fall risk with the decreased bone strength and the osteoporosis really puts you at risk for these kind of fractures.
And definitely things to keep in mind as we get older. So let's say I break my hip, fracture my hip. I come to you there at GBMC. What are some of the treatment options that are available now to help treat a hip fracture?
Yeah. So there's really three kinds of hip fractures that we see. One of them is a pelvis fracture, and that one's just treated non-operatively with weight bearing is tolerated. So they can just get up and walk because the bone tends to compress. The two that we're mostly talking about are called femoral neck fractures and intertrochinteric hip fractures. Femoral neck fracture is inside the capsule of the hip, and it doesn't have very good blood supply. So we tend to treat those with a hip replacement. If it's non-displaced, we'll sometimes treat it with pins, but usually that femoral neck fracture gets treated with a hip replacement, usually a partial hip replacement. The other kind of fracture is called an intertrochinteric hip fracture, and that one tends to occur a little bit farther down the bone, and there's much better blood supply there, so it's more amenable to healing. So we can treat that with a rod, and the patient keeps their own hip, but oftentimes those are a little bit harder to heal. So when a patient comes in with one of these fractures, one of the key things is we want to make sure that they can get to, and they need surgery. We want to make sure they can get to the operating room in a timely fashion. We want to make sure they get medically optimized. We have a pharmacist that looks over their medications. We have physical therapists that evaluate them, care managers. But mainly, it's in the first few hours, it's a collaboration between the medical doctors and the orthopedic surgeons and the anesthesiologist to make sure that the patient's ready to receive the anesthesia that they need to have a surgery like this.
Okay. And in terms of recovery time, how long are we talking? Does it depend on, you kind of touched on it, depending on the type of fracture that you have?
Right. I tell everybody it takes a full year to recover from one of these fractures. Most of the recovery is going to happen in the first 3 to 6 months. But if you have a fracture, like an intertrochinteric hip fracture with a rod, you're going to be able to get up and weight on it right away, but you're going to need a walker, and then it will take weeks to months for the fracture to heal, and then you'll have to work on your strength and endurance after that. So it does take a long time to recover after these fractures.
Very good. If you are just joining us now in our Facebook Live discussion, we are talking to Dr. Johnston from GBMC. He's an orthopedic surgeon there. We're talking about hip fractures, how they happen, how they're treated, and also to how they are prevented. So in terms of recovery too there, Dr. Johnston, what are some things that people need to be doing or making sure that they're listening to their doctors when it comes to making sure that they are recovering in a timely fashion and doing it so that they're as strong as they possibly can be?
Right. I think one of the strengths of the hip fracture service and this model of care is the collaboration. So the working with the medical doctors and the pharmacists. So a lot of times patients are on too many medications, and that raises their fall risk. They might be on a medication that slows their heart because their heart was racing, but that can also make it so that when they first stand up, they're higher risk for falls, or they might be on a medication that makes them drowsy. So we really look carefully along with the pharmacist about the medications. Once you're in the hospital and you go through the surgery, we have a wonderful group of physical therapists who are really eager to get the patients out of bed, into the chair, get them up and moving, get them evaluated. And then there's a whole continuum of care that goes from the time they arrive in the emergency department into the inpatient setting. And then there's often a period of recovery in a skilled nursing facility. It's often really hard to go straight home for an older patient after a fracture like this. So oftentimes they'll go and do a little bit more recovery with aggressive physical therapy at a skilled nursing or acute rehab, and then go home after that. I think it's really important to eat a healthy diet, get enough vitamin D, make sure you're staying well hydrated. All those things. And then it's good to have some family members or friends who can be there as a support, because having the fracture is tough. Doing the surgery, there's a certain adrenaline rush. People, and then in the few weeks after it, I think people get a little bit down. So having some friends and family there to support them, I think can make a big difference, because after the first few weeks is when you start turning the corner and start feeling more like yourself. So I think we usually see the patients at about 2 weeks after surgery, and then again 6 weeks after surgery, and then 3 to 6 months. So we keep in contact with their therapists and with their primary care physicians.
Yeah, is it important to keep in mind, like, not to push yourself too much? Like you said, you might start feeling good, you might start feeling like back to your old perky self, but is it possible to push it too far where you might undo some of the healing and the recovery?
Yeah, I think it's important to let pain be your guide. So if you have a lot of pain, that probably indicates you have too much swelling. There's complications that can go along with the fracture, like a blood clot. So if you have a lot of pain and there's swelling, that could be a sign of a blood clot. And, very rare risk of infections. Also, things like urinary tract infections tend to be older and more common in older patients, and lung complications like pneumonia. So what we're trying to do is we're looking at the most common problems that occur, and we're trying to address each one, preventing pneumonia, preventing urinary tract infections, preventing blood clots, so that the patients can have hopefully event-free recovery and get back to their life. Because people have a lot of living to do. I mean, as you get older, there's a lot of things going on, and this is a major problem for people that, they have weddings to go to, they have family vacations, and you break a hip and then everything kind of stops for a few months. So we are keenly aware of the need to get people back into living their lives. So.
Absolutely. Yeah. What about the chances of breaking or fracturing your hip again? Let's say you've already done it once. Does it increase the likelihood that that could happen again? And is that something people need to be more mindful of, especially, our older population?
Right. So like I said before, if anybody had missed it before, I think the hip fractures are a combination of decreasing bone health as you age and increasing fall risk. So the people who break one hip are clearly at higher risk for breaking another because they often have those risk factors. The long answer is absolutely yes. So when someone breaks one hip, we know that there's something not quite right with their bones. There are rare examples where someone's in a car accident or falls out of from a height, and they break a bone, and that might be normal bone. It was just a lot of energy. But in general, ground level falls, when you're walking along and you fall and break a bone, that indicates that there's something amiss with your bone. So it's almost always osteoporosis. There are a couple other causes, but the best analogy I have is infrastructure. So the bone is like the infrastructure of your body. It supports everything. And just like the roads, you get potholes and small cracks in your bones. And over the years, as we are running around doing things, lifting things, these small cracks need to be repaired. So there's a constant process of remodeling going on in your body to fill in those cracks and change out the bone. And as we age, that isn't happening as quickly, and the bone tends to get very soft and porous, and that will lead to osteoporosis. So what we have here is it's called a fracture liaison service, and it's a fancy word for a team of people that seek out patients who are at high risk for fractures. And if you're looking for the highest risk patients for another fracture in Baltimore or in Towson, you look at the people who've had a prior fracture. So people have broken their wrists, people have broken their proximal humerus, their shoulder, have had a hip fracture. Those are the people that are the most likely to break another bone. So we aggressively reach out to those people and get a Dexa scan. You're probably the Dexa scan is something that checks how the quality of your bone is and the strength of your bone, and it's non-invasive. It's very simple way to do that. So we check everybody with a Dexa scan. Then we usually check vitamin D levels. We check their kidney function, and then we have a couple of key guidelines for people who are at high risk for fractures. One thing is avoid heavy drinking. Another one is avoid smoking. We want to make sure that people get enough weight-bearing exercise. I'm sure you've seen when they bring the astronauts out of the International Space Station, they have to carry them out on gurneys often because so they're weightless for months and their bones can actually get soft. So if you're do weight-bearing exercises regularly, that will actually stimulate these cells in your bone called osteocytes to create more bone. So weight-bearing exercise, avoiding smoking, avoiding drinking, getting enough vitamin D and calcium, eating a healthy, well-balanced diet, those sorts of things can really help prevent fractures.
And these are things that we should probably be doing. I'm in my late 30s. So are these things I should be doing now so that once, as I get older, then I can, make sure that or increase my chances of not getting a hip fracture later in life?
Yeah, absolutely. And even younger. So we want women in particular to reach peak bone health. And so they want to get to a certain point where they get their peak bone mass and then you start losing after that. So even young women, we want to make sure they're eating a healthy diet and getting exercise. But particularly after menopause, that's when we start worrying about it because there's three cells in your bone that are really important. One of them is called an osteoblast. That's the bone maker. One is called an osteoclast. That's the bone taker. And then you have the osteocyte, which is sort of the regulator. And as you get older and lose that estrogen because of menopause, the osteoblasts are no longer get this activation signal. And so the whole process slows down. And it used to be, 20 years ago, a lot of women, when they went through menopause, they would get doses of estrogen for the symptoms, and they've stopped that. And one orthopedic surgeon out in San Diego, is very well known, has termed this the Silver Tsunami. And so she says there's this large group of older patients who should have gotten estrogen 10, 20 years ago, but haven't, and they're coming in and now have terrible osteoporosis. And there are definitely downsides to estrogen. That's why we don't use it anymore. But I do think there's a large group, a large population in Baltimore and around the country that are at very high risk for osteoporosis now.
So all the more reason to be regularly talking to your doctor, making sure that you are getting exactly what you need so that we can avoid a trip to get our hips repaired. Looks like, Dr. Johnston, we have a question. They said something, what about walking? Will that help? I'm guessing in terms of staving off possible osteoporosis, hip fractures, things like that. I imagine that'd be good daily exercise to be doing.
Yep. I think walking is a privilege. I think that we should be, it's the best exercise you can get. Get out with some comfortable shoes. It's low impact, but it is weight bearing. I think those sort of exercise, I think jogging is great. It tends to put a little bit of extra stress on your joints, which can have some problems, but I think walking is wonderful. You get great cardiovascular benefit. It's weight bearing. And I think it's probably my favorite exercise.
Mine too. I love a nice long walk, especially with this weather that we've been having lately. Beautiful. It has been wonderful to take advantage of. So, well, very good. Well, before we wrap up, Dr. Johnston, anything else you think is good for our viewers to know about hip fractures or taking care of our bodies and making sure that
I think two things. The key message is, if you have broken a bone, even if you just broke your wrist or if you had a proximal humerus fracture, even if you had 100% recovery, if you broke it after the age of 50, you're probably at pretty high risk for breaking a hip. And sometimes people have the fracture and they forget about it, and they don't get checked out for osteoporosis. So a simple way to get checked out for osteoporosis is to get a Dexa scan. You can ask your primary care physician to do that, or we have a wonderful program here called the Healthy Bones Program with Julie Merrill. She can do the full workup too. But I think it's really important to realize that if you've broken a bone after the age of 50, then you're pretty high risk for hip fractures. And breaking a hip is a big problem that it's hard to recover from. It takes a while. So if you can prevent a fracture, that's the best way to do it. The other key thing is as we age, the bone health declines and the fall risk increases. So anything you can do to decrease fall risk, keeping strong, looking around your house for things like electrical cords or rugs that might cause you to trip, trying to make sure you have a light on in the evening if you're getting up to go to the bathroom. So anything you can do it's not just increasing your bone health, it's also decreasing fall risk. That can also prevent fractures. So another thing is on November 11th, we have our third annual bone hip summit, and it's all about osteoporosis and hip fractures. And we have some local and state level leaders in bone health who talk about osteoporosis and management. So we're really excited about doing that again. Anyone is welcome to attend that. It's not just for healthcare providers. So November 11th at 8 a.m. There's more information on the website.
Okay. Yeah. And looks like we have the website up right there, and very good. All right. Well, this has been a lot of great information. Dr. Johnston, thank you so much for joining us this morning and sharing your wealth of knowledge. And hopefully, we've all learned a little bit something, and don't have to see you anytime soon because we're taking such good care of our bones.
Great. Thanks a lot, Megan. I appreciate the opportunity.